So this lecture is on sleep problems and disorders, which is a part of chapter 4 in your textbook. A quote to start off the lecture is, "Sleep is an investment in the energy you need to be effective tomorrow." I don't think we realize how affected we are by lack of sleep, and we'll look into that a little bit later, the effects it can have on us. But I think it really does a lot more to us than we can imagine, because it really is an investment in what you need to be effective during the day. Circadian rhythm disruptions. One of those is jet lag, which is a collection of symptoms that results from the mismatch between our internal circadian cycles and our environment. An example of that might be the level of lightness outside. For example, we might fly from somewhere where it's daylight at 3 p.m. into somewhere where it's dark at 10 p.m. So that really messes up our circadian rhythm when it goes from light to dark or dark to light very quickly. Another concern with circadian rhythm is rotating shift work, a work schedule that changes from early to late on a daily or weekly basis. An example of that, let's say Cynthia works 8 a.m. to 4 p.m. Monday, Wednesday, Friday, but works 4 p.m. to 12 p.m. on Saturday and Sunday. That could really mess up her circadian rhythm because she's going from working during the day when it's daylight to nighttime where it's night half the time. So that can mess it up. So as I mentioned, I think insufficient sleep really has a lot more consequences than we realize. Obviously, decreased levels of alertness and decreased cognitive function are going to be some of those consequences, but also obesity, increased blood pressure, increased level of stress hormones, immune deficiency, irritability, which we know is a common consequence of sleep, and you become a risk to others. For example, if you're driving while you're very sleepy, you could be a risk to other people on the road. So lots of consequences to insufficient sleep, some we wouldn't even think about. I thought this chart, I just wanted to include this because it's interesting information, but it's sleep needs by age. As you can see, newborns and infants need a lot of sleep, 14 to 17 or 12 to 16 hours a night. Toddlers still need a lot of sleep, 11 to 14 hours. Preschooler, 10 to 13 hours. A school child getting up to 6 to 12 years needs about 9 to 12 hours. And as a teenager, about 8 to 10 hours. And then as adults, which I'm sure all of us are, you need about 7 to 9 hours of sleep. I know they say the average is 8, but that makes sense. It's pretty much 7 to 9 hours. So it's important to make sure those age groups get enough sleep. So let's get in, those are sleep concerns. Let's get into some sleep disorders. Insomnia, which is a consistent difficulty in falling or staying asleep. It is the most common sleep disorder. A formal diagnosis requires experiencing insomnia at least 3 times per week for at least 1 month. We've all experienced insomnia from one time or another, but to receive a formal diagnosis as a disorder, again, you have to experience it at least 3 times a week for at least 1 month. Insomnia could be the result of age, drug use, exercise, mental status, or just simply your bedtime routines. Not having a good routine, I would think. So let's look at how to get healthy sleep and how not to get healthy sleep. First, let's look at how not to get healthy sleep. Obviously, drinking a lot of caffeine before you go to bed is going to affect you. If you're really stressed, that's going to keep you from having good sleep. A blue light, as in looking at a cell phone while you're trying to fall asleep, that light is going to keep you awake and not help you fall asleep. Heavy food, eating that right before bedtime can keep you awake. The things that can help you sleep and have healthy sleep, kind of obvious, but a comfortable bed, staying on a schedule, not messing with your circadian rhythm and staying on a similar sleep schedule every night. A shower before going to bed can be helpful, and having fresh air in the room. Another disorder is sleepwalking, which is when the sleeper engages in relatively complex behaviors, ranging from wandering about to even driving an automobile. These sleepwalkers often have their eyes open, but they're not responsive to attempts to communicate with them. REM sleep behavior disorder, or RBD, is a sleep disorder in which you physically act out vivid, often unpleasant dreams with vocal sounds and sudden, often violent arm and leg movements during REM sleep. It's sometimes called dream enacting behavior, where you're essentially acting out your dream, possibly in your sleep. Restless leg syndrome, uncomfortable sensations in the legs during periods of inactivity or when trying to fall asleep, which obviously can make it very difficult to fall asleep. Night terrors are sleep disturbances where you partially wake up and experience fear and panic. You might scream, get out of bed, or move around violently. As soon as the episode is over, most people go right back to sleep and don't even remember it in the morning. Sleep apnea is when your breathing stops and starts while sleeping. There are two types of sleep apnea. Obstructive sleep apnea occurs when the throat muscles relax and block the airway. Symptoms might include snoring loud enough to disrupt your sleep or your partner's, waking up gasping for breath, and excessive tiredness during the day. Central sleep apnea, on the other hand, is caused by a brief lack of communication between the brain and the muscles that control breathing. So it's most associated with an underlying medical condition. SIDS, or sudden infant death syndrome, is when the infant stops breathing during sleep and dies. Some possible causes could be premature birth, smoking within the home, and hyperthermia. There also may be differences in both the brain structure and function of that infant. However, as most of you probably know, there's really no definitive cause of SIDS. We don't exactly know why it happens. Narcolepsy, the final disorder we'll discuss, is a rare long-term brain condition that can prevent a person from choosing when to wake or sleep. The brain is not able to regulate sleeping and waking patterns normally. So some symptoms may include excessive daytime sleepiness, falling asleep and suddenly without warning, which is what we mostly think of when we hear narcolepsy, and loss of muscle control, or cataplexy. So that was the last disorder we talk about, and a lot of those I think we are already familiar with, but hopefully that was a more detailed description of some of those disorders. If you have any questions, let me know.